Welcome to season 2, episode 16 of Dr. G at the Heart of Healthcare. I have Jon Duerden, the administrator of Pacific Villas Post Acute, a brand new ground up construction of a skilled nursing facility, nursing home that's opening in San Diego. We're going to have the ribbon cutting on Thursday, June 27th. By the time this airs, we would have already had the party, but we're here to talk about it and just this wonderful gift that we're having in the community. Hi, Jon.
Hey, how are you doing? Thanks for having me.
I'm
Happy to be
excited.
here.
Happy to have you. So, first of all, Um, okay, I think we're going to have a lot of fun today. So, first of all, tell the audience about your background. How did you become an administrator of a skilled nursing facility? Like, give us your mini bio.
Yeah, I mean, it's not one of those things that as a kid growing up, you think you're going to be a skilled nursing facility administrator. And it's kind of interesting how my path led here, but I couldn't be happier. I've always been interested in healthcare. Healthcare, ever since being a little boy, was very interesting to me, but I didn't have the temperament for bedside care. I grew up in a very entrepreneurial family. My father actually owned a whitewater rafting business. So I grew up as a whitewater river guide. I'm the fifth of seven kids, and all of us were river guides. So we rafted. We had multi-day whitewater rafting trips on the Salmon River in Idaho. So
Whoa,
very
that's
different to
scary.
what I'm doing now. It is. It is. It's so fun though. Very different to what I'm doing now, but that entrepreneurial background led me to skilled nursing administration, which is kind of crazy. So, like I said, I was interested in healthcare, didn't have the temperament for bedside care. And so this healthcare field kind of married with the business of skilled nursing was a perfect marriage. And I love it. I've been an administrator with the company PAX since 2019. And I've loved it. I haven't looked back. I operated facilities in LA and Long Beach. And now I've been tasked to come open this brand new facility in Oceanside, California.
All right, well,
So
you're talking about
fun,
my
fun challenge.
hometown. You're talking about
That's
my
right.
hometown, LA,
That's right.
where I live
Yeah.
in Long Beach. So, are you from Idaho?
No, from Utah originally, but we've
Okay.
been here for about 6 years in California. My wife's from San Diego. I'm from Utah, and so happy to be here in the sunshine.
I had a little bit of time in Utah. Some of the listeners know my son played football for the University of Utah, so I had some time in Salt Lake
Amazing,
City. Yeah.
gorgeous.
Wow. So that water rafting, that sounds scary. Whenever I see those videos, I'm like, I'm never doing that because that thing is gonna flip
Oh,
up.
it's the best. It's the best. It's so fun. So fun.
Okay, well, let's get on target. So, thank you for your background. You know, we need great leadership. I said that in a recent podcast about as a clinician, like I value having, leaders like you who enjoy this, who bring the spirit of excellence to the organization, keep us compliant. So bravo to the administrators. So anyway, let's jump into this new um, facility that's opening. I actually recently had the opportunity to get a private tour of an empty, beautiful Pacific Villas post acute, and it was gorgeous. Like it felt like one of those like assisted living. So tell us about the construction and all that stuff. Like, how did we come to this point of getting a brand new ground up sniff and who designed it and all that stuff? I heard there hasn't been one in the community that was brand new for about 30 or 40 years. Tell us about that.
Yeah, yeah, yeah. So the parent company PAX, about 7 years ago, if you can believe it, 7 years ago, they bought the land. It's just right across the street from Tri City Hospital on Thunder Drive. It was, large in part was a dirt lot, and they bought it wanting to, with this vision of constructing a new 120 bed skilled nursing facility for the community. The demographics are aging, the population is getting older, so the need for skilled nursing facilities is just going to continue to grow, and the need for good skilled nursing facilities. I think we had talked about a little bit before the show about kind of the stigma that there is with nursing homes. That it used to be that they were just kind of these convalescents where they were dirty, they were dark, they were old, they were depressing. People didn't want to go there. But really, in the last, I would say, 7, 8 years, that has changed. The expectations for skilled nursing facilities is different. We care for high acuity patients, and our goal, if it's appropriate, is to get these people back into the community. We Pacific Villas is going to be primarily short-term patients. So they're going to be with us to rehab from surgery, from injuries, from infections, from wounds, and we want to get these people back into the community. That's our goal, is to get them better, get them healed in an environment that is conducive to healing. You see those pictures of the scary old nursing homes that just nobody would want to go there. But Pacific Villas, the idea is to heal in an environment that is new, is updated, that uses cutting edge technology, and just feels like a place that you would want to be. Honestly, I think our biggest problem is going to be convincing people they want to leave. It's beautiful, just like you said.
Yeah, and everyone here knows that I do hospice and palliative care. I was struck by some of the private rooms, how some of our hospice patients can, be there. Sometimes we need to do general inpatient, meaning we need to have a higher level of care, sometimes a
Correct.
respite. And we do have some of those folks who don't have family and they do live there, but I think the place is just gorgeous. So, yeah, so let's dig more into that stigma, because I've seen people say, I'm never putting my mom there, or people say I never want to go there, and they don't really understand the reason why someone needs to be in a skilled nursing facility or a SNF. Let's kind of maybe define that for folks so they understand the great importance of places like this.
Yeah, I think the understanding is what is being missed, because there's just such a stigma, like we had spoken about, that people just want to avoid them at all costs. But skilled nursing facilities are kind of like a crossroads, if you will, for healthcare. That after that short stay at the hospital, patients come to a skilled nursing facility, and from there, it's kind of disseminated out into the community what the next step is. Whether that be back home, whether that be an assisted living or more of a permanent solution, whether that's a board and care or whatever it may be. We have the resources in the skilled nursing facility to help facilitate that. So we've got the social workers and discharge planners that we can help, apply for different types of insurances or government programs. So it really is a great place where people, when they need that little extra bit of help after the hospital stay, can come to us and we can help figure out what their next step is going to be. And while they're there, they're going to have inpatient physical, occupational, speech therapy, pulmonary rehab, wound care, IV management, pain management. Pretty much anything that isn't acute inpatient stay can be done at a skilled nursing facility, and one specifically like Pacific Villas that is ready to take those type of patients.
Yeah. Yeah, and I wanna, add the additional side. The goal is to get them back home, but the reality is sometimes there's people who seniors, this is a decline that is not reversible, right? We know the
Correct.
number one cause of morbidity and mortality among seniors is falls. They
Correct.
fall, they break a hip, they get the surgery, they go to the skilled nursing facility to get the PT, but they don't progress. So I want to touch on that a
Hmm.
little bit, because that's when I get them on hospice, and I'm always like,
Yeah.
oh, the family's taking it so hard, where mom or dad is not coming home, where, we
Yeah.
need to bring on hospice. We need to figure out all these things. Um, so, so how can we help our listeners, kind of understand those situations when, there's some kind of catastrophic event or something that happens where they don't progress in, and the
Hmm.
community may say, hey, we need to consider hospice. I always like
Yeah.
to bring
Yeah.
that up.
It's a great point, because every person's situation is totally different, right? Not It's not this pre-canned care plan that everyone is getting the same one. When a patient is admitted to us, there's a care plan that's based off that patient. So the physician, the therapist, the director of nursing, social services are all going to get together, review the patient, and look at what the goals are. Now, like we've talked about before, if it's possible to return home, that's what we're going to try for. But for some people, it's not. And for those people, we want them to reach their highest goals that are appropriate for those patients. And sometimes those highest goals are hospice. Sometimes that is just the way that it is that we want to help these patients with dignity be able to live out the last days and in comfort and peace and compassion. And so I think that's the emphasis there is each care plan is very, very much tailor made to the patient. And so there's some that are motor vehicle accidents or orthos or stuff like that are going to be discharging back home. But there's some that, like you said, Dr. G, have had more of like a catastrophic event, and there is a decline, and it is foreseeable that they're at the end of life. We want to be able to handle those patients in the best way possible, make sure the family's understanding, we get them the help that the patient needs and that the family needs. And so communication is big for us. We make sure that the care plan is great and customized, and that's communicated well to the family so they know what expectations are.
That's fantastic, and I'm glad you brought up the care plans, the plan of care, because that's how we function in hospice too. It's not just go home and that's it. The benefit
Hmm.
is for 6 months, and it can be longer, but the patient tends to have a prognosis of 6 months or less, and we can recertify. But we have a plan of care for every body system, and we are working towards things. That's within lines of the goals of care. So that's good. We could relate to that. So I want to get to the party. So tell us tell
Yes,
us
the fun
about this.
part.
Yeah, yeah, yeah. We did the education part. And so I am looking forward to this ribbon cutting. Tell us what region you'll be servicing and this party, like what's going to happen there.
Yeah, yeah. So obviously the facility is for the community. We want to be a partner. We want to be beneficial. We want to be serving our community. And so our idea was we want to announce it to the community. This project has been so long since the inception of the idea, almost 7 years ago. 2.5 years of construction during COVID. We feel like a facility like this deserves a grand opening for the community. And so, we want our community partners to come, obviously you, Dr. G, our physicians, our hospitals, and really with a facility like this, we're going to be serving the community, not just in Oceanside, but in San Diego proper. We imagine patients will be admitted from Orange County, from even Riverside and LA County, because it's not very common. Like we talked about in San Diego County, this is the first one in many, many years that's a new facility from the ground up. California in general, there's not very many of these. It's pretty uncommon that there's a ground up new construction skilled nursing facility. So it's fun, it's exciting. The community's excited. Everybody is asking about when is it going to be open? When are we going to be ready? And you know, there is still some hoops we have to jump through with the health department to make sure all the licensing is there and in place. But we're at the finish line, which is very exciting. So that's why we're having this, big open house this coming Thursday at 3:30.
Okay, well, I will be there, with bells and whistles. So, what are some of the, maybe someone listening to us, they want to get in the field like you, they're thinking about this as a career. What are some of the hoops or some of the challenges that you have to do for licensing? And I know there's something about five
Mhm.
patients and something like that. I don't know, but tell us about that. Educate
Yeah.
us.
So yeah, so it is unique with new construction facilities because obviously we'll be duly certified, Medicare and Medi-Cal certified. The state has to come through the health department. They review all of our policies and procedures and make sure that we're ready to take care of patients. After that, we're going to be taking 5 test patients, which are patients that we provide care for free of cost. That is basically the patients that the health department wants to make sure that our documentation is in place, that our policy and procedures, that our vendor contracts, that our pharmacies, because everything is done in house in our skilled nursing facilities. All of our therapy. We have our pharmacy that's there at house. That there's pharmacy delivering 5 times a day. there's so much going on at a skilled nursing facility that a lot of people don't think about. We have to make sure that everything is dialed in and ready to go. And then the health department signs off on that, and then we start admitting patients from the hospital.
Fantastic. Wow.
Yeah,
Well, I don't have any other questions about this. I'm just excited for this ribbon cutting to celebrate what this is, but I really want the listeners to um, just, just, just kind of face the stigma against nursing homes and things of that nature. Of course, we've heard horrible things, especially from the pandemic and things going wrong, but these are wonderful facilities to provide health care for vulnerable populations when they are done in the hospital. Again, that's why this is called post acute, and they need to have that more intense care in that
yeah,
type of environment in 24-hour care. And I'm excited for, some hospice patients that, could benefit from it and GIP and things like that.
yeah.
I'm excited. So if there's any other
So
things you
fun.
want to share, anything other things you want to share before we wrap this up, that would be great.
I mean, it's hard to describe because the facility is just so immaculate. They've done such a great job with the design, with the artwork, with the layouts of the rooms. All the rooms are either private or semi-private suites. They're all in-room bathrooms and showers. It's just, I mean, it feels more like a hotel than a skilled nursing facility. It is stunning. It smells good. The therapy room's great. The food is incredible. We have a classically trained dietary supervisor. It's just, I mean, we're just all so excited because it is unique, it is fun, it is. I mean, I just couldn't be more excited, and I'm excited for the community to see it and for it to actually start be beneficial to people.
Yeah, and it has good physician rooms too. I went in there and checked it out where we can do our
Yes,
documentation.
yes, yes. Usually, physicians are documented on a bedside table in a corner. They have their own physician rooms. I think I'm gonna
Yeah.
add some massage chairs in there too.
Okay, then I won't leave.
I know you will. I know.
Oh, well, thank you for being here. By the time this airs, we would have had the party, but this is just a beautiful addition to the community of San Diego to help Californians, to support the local hospitals, and to just be a great thing. So thank you for being here, Jon.
Thanks, Dr. G. We're excited.
All right. Peace, everyone.
Thank you.